Did you know that anxiety can be closely linked to your hormones, and hormone imbalance can create more anxiety or just create anxiety in a person who's never had anxiety? So join me today as we talk about the connection between hormones and anxiety. I'm Dr. Shelley Meyer. Thanks so much for joining me. I am a functional medicine doctor, registered dietitian, and a family medicine doctor. So I work with my patients a lot and my clients a lot on hormone balance. We work on gut balance, hormone balance, holistic health, regular old family medicine. But I see a lot of anxiety. It's gotten worse. I see a lot more in women than I used to, but I see a lot of men with anxiety. A lot of times when we work on hormone balance, we can get to the root of what might be at least worsening the anxiety, if the anxiety was already there, or creating a new kind of set of anxiety symptoms that weren't there before. So I've talked in the last few weeks about anxiety. So if you are interested in more information about gut health and anxiety, or exercise and anxiety, check out my most recent videos. But first, I would love to request that you subscribe if you haven't done so already. It's so important to me, and it means a lot to me to help the channel grow so I can keep making content. And if you like the videos, hit the like button and the thumbs up button and hit the bell to be notified when I post new videos every Friday. But thanks so much for being here. I really appreciate it. So like I said, I have experience working with people from a holistic perspective on their anxiety, and I do see a strong connection between hormones and anxiety. So let me give you some examples. So cortisol, one of your stress hormones, adrenaline, another one of your stress hormones. I do a lot of cortisol testing, and we usually do it, sometimes we'll do it via blood work, but we usually do it like with the Dutch test that I talked about a few weeks ago, and that's, or a couple months ago. That is in my playlist in my channel. But that is a way that we test it via urine. I also use saliva samples sometimes to test cortisol, because you can, with the urine or saliva, you can test it kind of periodically throughout the day to know what the kind of whole day cycle of your cortisol is like. Because sometimes if we do blood work, first of all, poke in the arm, that can create cortisol spike, and so maybe it's not a real number, and then we don't have as many markers to look at the pattern. So anyway, that's a way to test it, to see if your cortisol is high, and then you can see if it correlates with your anxiety. Because anxiety is a state of stress, then that's going to create more of these stress hormones. So that connection is really clear between the two of those. And stay to the end, I'll talk about ways to manage that. Another connection I see is when I see a lot of women going through perimenopause. I've been through it myself. It's those years anywhere from like the 2 years before actual menopause or up to like 10 years. Sometimes it's usually not that long, and then actual menopause is just the day where you've gone a year without periods. So that's kind of a confusing classification for some people. Menopause is not when you stop having your periods, like for the rest of your life. You're menopause, you're either premenopausal, peri, meaning around menopause, or postmenopausal, and menopause is just actually one day. But that's not really essential to our video today. But so menopause or perimenopause is when your hormones are kind of fluctuating. Your body's like, what's going on? It's trying to hang on to, and this is in women, obviously, trying to hang on to its fertility, its estrogen, its progesterone. So you're getting these spikes of estrogen or drops in progesterone. Too much estrogen, too little progesterone is a common lengthened phase during that perimenopause, and that can contribute to anxiety. But as it shows you the Goldilocks effect of hormones. So too high of estrogen, too low of progesterone can create anxiety, but too low of estrogen can create anxiety. So when you're in menopause, when you're close to menopause, when it's kind of fluctuating down and you're getting those hot flashes, then that can contribute to anxiety as well. So if you're perimenopausal, end stages of that, close to menopause or postmenopausal, it could be from your low estrogen. If you're early perimenopause, it could be from your high estrogen. I'm kind of skimming through this a lot, but I do have a lot of videos on perimenopause, so please check those out if you are in your 40s, a woman in your 40s, early 50s, even late 30s, and you're feeling a lot more anxiety. It could be related to that. And then too much progesterone, which we don't normally see unless you're taking progesterone or you have some kind of tumor that's secreting progesterone. That could create anxiety as well. So if you're on bioidentical progesterone, to help with your perimenopause or menopause symptoms, and you see a spike in your anxiety, maybe look at your progesterone levels. Same with estrogen. If you're replacing estrogen, you want to look at your estrogen levels, because too much or too little estrogen can create anxiety. So those are the connections there. I also see men in my practice. Too much testosterone can create anxiety. Not usually too little testosterone, which is usually what men would come in for. But I do have men that on their own, you know who you are, are, if you're watching this, are doing testosterone from a different provider. I do prescribe it, but I have some men that are getting it from a testosterone clinic. And when we test their levels, they can be really high. If they're getting like a testosterone injection or using too much testosterone, again, that can definitely create anxiety. So if you're having mood problems and you're a man, check your testosterone levels. Too little testosterone, maybe, could cause some anxiety, more so like slowing down of things, depression, low libido, and that can be in women too, because we need testosterone. Not as much of a link with anxiety, and some women are replacing their testosterone through hormone clinics, or I do prescribe it for women that need it too, and that may be a hint that we're overdoing it as well. So there's a lot of links between mood, anxiety, and your hormones. So knowing that connection can give you more ways to check out your anxiety and see if it is not just here, but in other, axes, organs in the body that are contributing, or phases of life. So let's get into what do we do about it? What do I do about when I see that? I check hormones. I will look at the Dutch test or a saliva cortisol test. A lot of times if somebody doesn't want to spend the money on an expensive functional medicine test, they want to go through insurance, I will, do a cortisol, but we usually have to do the fasting 7 to 9 a.m. cortisol in the morning via blood work. Not nearly as accurate, but I will do estrogen, progesterone, testosterone, including free and total. It would be estradiol, progesterone, free and total testosterone in women to look for imbalances and via blood work, and that usually can go through the insurance in the U.S. And then in men, check their free and total testosterone. The reason I do free and total is because free is the amount that your body actually feels. Testosterone, just like any hormone, can be bound up with sex hormone binding globulin. So we want to look, if we can, at the free and total testosterone. If your doctor will only do a total, that's not meaningless. You can still check it and see. So I'll look at that. I will dig into lifestyle. That's covered in other videos, but it's definitely important to be exercising, to eating a whole foods diet, avoiding processed carbs and sugar and excess alcohol and caffeine. So you definitely got to dive into all that. But we're speaking specifically of hormones and anxiety now. So we'll look at that and see what is imbalanced. If somebody's got too much estrogen, if a woman's got too much estrogen, then I will... And, of course we need estrogen. I'm not trying to deplete the body of estrogen as a provider, but I want to see that balance between the estrogen and progesterone. I usually test it on day, night. If you're cycling, I will, still having a period, I will test it between day 19 and 22 of the cycle often to get that good ratio between estrogen and progesterone. That's during the luteal phase. But, it can be tested other times of the month. If you're not cycling, if you're postmenopausal, you can really test it anytime. And then I just look at the normals. I look at, what I would consider within normal range and a good ratio of the two. Make sure the estrogen's not way too dominant or way too depleted. And then adjust accordingly. So I have other videos on perimenopause, and it's a bit too much to go into here. But check those out to know what I look for and how I treat that. And then if testosterone's high in a man or the progesterone's high in a woman, it's probably for replacement. So we're going to lower the bioidentical replacement. If some women are on fake progesterone, which I do not prescribe, like progestins, Depo-Provera is an example. That's a injection for birth control. I will try to take them off of that because that can cause anxiety. Usually it doesn't cause a high progesterone in the blood, but it can cause anxiety. Or, if they're on an oral contraceptive, a birth control pill with that progestin in there, I may address that and see if it got worse after starting that birth control pill. And I will look at herbs that can help balance out hormone. There's a lot of adaptogenic herbs that can help tone the hormones. I love, and I'll put these in the description, Designs for Health FemGuard Balance, because it's great for perimenopause because there's that up and down of your hormones. For elevated cortisol, I love Cortisol Manager or Cortisol Calm taken at night. So those are things you can do. Always run these by your provider. Make sure that these herbs and nutrients are good for you, because I'm not your actual provider. But we don't go straight to those supplements. Ashwagandha is another balancing one. Magnesium can be very calming. You don't want to overdo it, but if you have loose stools, then you cut back. Or other than that, magnesium is needed in a lot of ways. But you don't always want to jump straight to that. Check out my video on exercise and anxiety, because exercise is very important for hormone balance and anxiety. You want to look at the diet, like I said, and make sure all those things are in place, and then address maybe adding some supplements. Or even in my practice, I do, like I said, bioidentical hormone replacement if it's appropriate for that woman or man, and that can help with anxiety. Cortisol balancing involves a lot of stress management. You can't just supplement your way out of a cortisol problem. You really need to look at how you're perceiving your stress, how you're managing your stress, how present you are, how, who in your life is toxic and creating more stress, what your job situation is like. You definitely want to have meditation on board, even if it's 5 minutes a day of a guided meditation, or even prayer for those people who use that instead of meditation. Deep breathing, so the square breathing, you can look that up, or the 4-7-8 breathing I talk about a lot. You want to get out into nature, make sure you have exercise going on. So for cortisol in particular, and for any hormone imbalance, you have to have those lifestyle pieces in place. If you're just supplementing, it's just like taking a pill or a medication. It's not going to do the whole trick. It's an overall complete approach. And of course, alcohol, you don't want to overdo. Sugar, you don't want to overdo. So I tell people, 20 grams of sugar, of added sugar or less per day. If you can get to 15 or less, that's even better. I'm not talking about fruit, I'm talking about added sugar on a label. The less, the better. The higher fiber, 35 to 40 grams of fiber is a good goal. Nice, clean, filtered water, if you can have that a lot throughout the day. Eating organic, if you can afford it, whole foods. And alcohol. So trying to keep your alcohol either 0 or to like 2 to 4 drinks a week. So many people are self-medicating with alcohol, and that creates more of a hormone imbalance. And so you're in that vicious cycle of anxiety and hormone imbalance. So I hope this has all been helpful. If you want to learn more about the gut-brain axis, I have a PDF. And I have a Trust Your Gut course for gut health improvement to boost that microbiome. And that's all listed in the description. I really appreciate you joining me, and if you liked this, please hit the like button and share this with someone you love. And I thank you for joining me today, and we'll see you next week.